Good morning, everyone, and welcome to another presentation of Meds Ed, the primary care education program sponsored by the pharmacy department here at CareOregon. My name is Paul Carson. I'm a training and development specialist at CareOregon. Let's go ahead and move forward here. Folks are always curious about CME completion credit hours. At the very end of the session here today, I'll be sending you an email to a real brief survey. CME comes from the American Academy of Family Physicians, and this session today is approved for 2 credit hours. Those credit hours are also acknowledged by the Oregon Board of Pharmacy, and the information I've been getting recently says they should also be applicable for CEU credit as well. So if you have any questions about that, let me know, but you should be able to apply a one-size-fits-all designation to these credit hours here today. But we'll get you all that information at the end of the session, and we'll send out that link. So let's go ahead and move forward with our next slide here. The learning objectives that will be on that assessment that we mentioned later, and this is sort of a broad strokes look at the content we're covering here today. You can take a look at that. We're going to be introducing you to the types of medical care that actually are offered from start to finish during jail custody. A lot of times folks assume there is not much going on there, but there is a lot more than you would guess. And also the partnerships that we're trying to establish between entities like CareOregon and different facilities really help with that transition process. And we want to talk a lot about stigma as well and how that gets in the way of care after custody. So I'm going to introduce our first speaker momentarily here, but I think it's important to kind of orient a little bit around where we're at with this topic. Because by the very nature of their circumstances, incarcerated people tend to be unseen by us. And unless you have some reason to visit a corrections facility, you hear about incarcerated individuals, but you don't typically see them a lot on a regular basis unless it's on television. And it may be tempting for us sometimes to assume that people in jail or in prison are there because they've made bad choices or have some kind of inherent failings. But the truth is that nobody in jail or prison planned to be there. Plot twists, if you will, can happen in all of our lives. Coming home from some social event involving too much alcohol, so all of a sudden there's an unexpected vehicular manslaughter that occurs. You didn't plan it. Nobody did, but it happened. And now it's you. And it could happen to any of us at any point in our lives. So empathy and compassion are important to maintain. We always try to bring trauma-informed care into our work at CareOregon. And when folks have an understanding of work that's been done, such as the ACE study, the Adverse Childhood Experiences study, which I'm guessing most of you probably are familiar with, but if not, I highly encourage you to look into that. It's super impactful to the work we're doing. When you have an understanding of studies like that, we come to understand the factors that can be responsible for people ending up on the wrong side of the law beyond mere bad choices. And I think that if we believe in things like second chances and redemption, then we must also have confidence that awareness of the past in our lives can help us open doorways to new levels of understanding, compassion, and healing. So let's go ahead and get our presentation started here today. I'd like to introduce our first presenter, also from CareOregon here. I want to welcome Cassi Sturtz this morning. Cassi is the Behavioral Health Manager for the Adult System of Care here at CareOregon. And prior to her current role here, Cassi spent over a decade managing a variety of dual diagnosis programs for individuals in the justice system involvement across the Portland metro region. Please give your attention to Cassi Sturtz. Cassi, please go ahead and take it away.
Thank you, Paul, and good morning, everybody. It is great to have you here. We are so excited. We wanted to start the morning out with you and just kind of level set and make sure that everybody's entering our presentation today with the same understanding. So first and foremost, it's important for us to understand what is jail. We talk about it a lot, and for those of us who don't interact with this population or this setting all the time, it can feel maybe a little bit confusing about why or when somebody is in jail as opposed to when they might be in prison or another type of custody. I'm going to make some very broad general statements today about what incarceration can look like and does look like. And it's important to recognize that the system is extremely varied. So how it looks and how it operates in each of our different counties and each of the different states can vary greatly. So we'll get into that a little bit throughout the morning, but just want to make it clear for folks that this is not a one-size-fits-all, if you will. So an important distinction today, we're going to be focusing a lot on jail transitions and what it looks like for folks to move in and out of our local jail systems. So jail is a holding place that can exist for folks who may be awaiting trial or may be kind of in a limbo, if you will. So they may not even yet be convicted of anything. They may still be waiting for different types of trials to occur, or they may be in fact convicted of some minor crimes, as opposed to a prison setting. So a prison setting is for folks who have been convicted of certain types of felony crimes. A second big difference between the two is that jail is a holding place for folks for all types of custody levels. So it may be that they are accused of crimes under federal law or state law or county or city laws. Again, that's a big difference between jail and prison that exists. Here in Oregon, most of our jails correspond to our county divisions. So, and they are most often correlated with our sheriff's office in the corresponding county. For some of our rural areas, this does get a little less clear because they may join, they may operate their jails together, or they may use another local jail system. And in Oregon, our prisons are operated and maintained by the state. So most folks have also probably heard about the role of private prisons, and those do exist. And we have most of ours operated by the state. Another key factor in kind of differentiating or understanding jail versus prison is time spent. So on the screen, I've added a couple estimates for some of our local institutions, just to give you a sense of what it looks like and how much time folks might spend in one versus the other. So jail tends to be shorter stays. So right here, you'll see on average here in Multnomah County, we see about a 5-day stay for folks, as opposed to our Oregon prison system, where we see an average stay of 69 months. So again, pretty big difference in folks' experience there. As we talk about transitions today, I want folks to understand that this is another place that we have a ton of variability and unpredictability for folks. So transitions can be impacted by lots of different things. So they could be impacted by the resources in the institution themselves or in the release county. They can be impacted by the staffing that occurs in that institution. They could also be unpredictable in times of understanding when somebody is going to release, whether that's the actual day or time that they're going to get out of jail, or what their outcome is going to be at the time of release. So folks can sometimes end up needing to transition to another institution, or they may end up being released on an evening or a weekend. And as you might imagine, that can greatly impact what somebody has access to immediately following that transition. It's important for us to think about also the supports that the individual has available to them. So some folks are going to have more resources, more natural supports. That is also going to impact their transition. And of course, somebody's ability to self-advocate. So that is deeply impactful in terms of getting to the resources that people need, sometimes not only in institution, but also when they're releasing back into the community. And then one point I just want to bring us back to, I think that most of us are familiar with, but is important to think about. We talk a lot about risk associated with transitions of care, especially for our folks who may be using substances and related risk of overdose. So it's important for us to think about anytime somebody is releasing out of a controlled setting, we see that elevated risk for folks for the first 90 days following that transition. So I want you all to be keeping that in the back of your mind as you hear what some of our other presenters share, and as you think about how you yourself may work with folks who are transitioning out of these systems. And with that, I will pass it back to Paul.
Thank you so much, Cassi. I appreciate that very, very much. I think that's a great way to set the stage for the work that's going on and everything that we are being involved in currently. Let's move on to our next presentation here and start our morning session and dive into some of these learning objectives and get deeper into our content. It is my great pleasure to introduce Myque Obiero. Myque is born and raised in Nairobi, Kenya, and speaks multiple languages, including Luo as a point of reference. That is the same tribe as Barack Obama's father. He spent a large part of his life in the Kibera slums, one of the largest in Africa. Professionally, it's dizzying to look at the different roles that Myque has served professionally. He's currently serving the role as director, RHA for Multnomah County Corrections Health. Previous roles that Myque has held include regional trainer for directors of skilled nursing, director of nursing and skilled nursing, health services director for assisted living and memory care, trainer in dementia care and memory care management, and ED nurse at Legacy Meridian Park. He's serving in the state's Alcohol and Drug Policy Commission as commissioner, and then somehow finds time to teach and coach for over 12 years for the Oregon City High School boys soccer team. I don't know where Myque finds his energy. It's just kind of dizzying, but it's pretty impressive. So please join us in welcoming our feature presentation to start things off, Myque Obiero. Myque, take it away.
Hey, Paul. So I just wanted to kind of offer a super quick update on a couple of things that Cassi presented earlier. Multnomah County, a lot of things change on a day-to-day when it comes to the jails. And I just wanted to mention that right now for Multnomah County, the average length of stay last week was 17. The week before was, I think, about 15. Right now, we're sitting at about 20 days as average length of stay. The other thing as well, when it comes to jail versus prisons, with the jails, one of the things that we've noted over the years is that anyone that has a sentence of around a year or less serves that sentence within the jails versus going to the prisons. And so sometimes we will see folks that are sentenced staying within the jails, but most of the folks that, as Cassi mentioned, pre-adjudicated and waiting their sentence so they can go to prison. Paul, if you wouldn't mind getting the first slide up, that would be great. So one of the things that we really focus on in our jails is we have a kind of a really big obligation to provide a community level of care. Corrections Health within Multnomah County Health Department is actually set up a little bit different than most jails, which is that we are not privatized. We're actually part of the health department, and which is kind of a unique setting. It's, I think, the only other one that I've found, at least regionally, is King County in Washington State that runs a similar model to what we do here in Multnomah County. We are accredited by the National Commission on Correctional Healthcare, and so that's a huge source of pride and a governing standard for a lot of the services that we provide, including obviously the medical, dental, behavioral health, and substance use treatment as well. We are a 24/7 operation, of course, and we have a lot of different classifications that work within our facilities. We have MDs, PAs, PMHNPs, we have health assistants, medical assistants, community health nurses, behavioral health clinicians, QMHAs, QMHPs, a lot of people that it takes to run all of the care that's provided within the corrections health division here in Multnomah County. We have a dental director that is here full-time, and dental operatories across Multnomah County Detention Center, which is one of our sites in the Justice Building downtown Portland, that houses about 448 beds. We also have a medium security jail out by Inverness Jail, which is by the Portland Airport, and that houses about, it can house up to 1,100 people, but right now sits at about 600 or so. We have a youth detention facility as well off of 60th and Gleason by Providence Hospital in Portland. And so across all three sites, we offer dental care. We do simple procedures, extractions, and kind of, dental cleanings. This is, for a lot of adults in custody, one of the things that you will find as the only place that they'll ever have this kind of care, because we are their only touch point with the medical, dental, behavioral health continuum. I think it's important to note too, when it comes to jail care, that language matters a lot as well. And so I wanted to mention that one of the things you will hear me use very frequently in my presentation is referring to folks in custody as adults in custody and youth in custody versus inmates or youth in detention, because it's really important to recognize that any one of us at any point, could find ourselves in these places, and it makes a difference kind of how we look at folks when they're at their lowest point in their lives, so many of them. And so adult in custody, youth in custody is the terms that we use within Multnomah County Corrections Health. We have, over many years, have a lot of substance use disorder treatment that we work with now, and we are expanding over the years to throughout all of our jails. We've always detoxed people when they come into the jails, but there's been kind of that growing change in the community to maintain people when they come into custody. There's a lot of death in the community from fentanyl. I'm sure this is not unique to Portland. And so substance use disorder treatment has become such a critical component of the care provided within the jail system. So that's something that, we can go into a lot of detail about, but one of the things that we're really proud of is that between Multnomah County, Clackamas County, Washington County, and thanks to Cassi and others, we get together and look at our community of practice and try to ensure that we are mirroring what the other county is doing, so the community knows, and the treatment is pretty similar across the board and across the region. So that's something that we've really been intentional about over the last few years. Behavioral healthcare continuum is something that is a big area of focus for corrections health as well. Ensuring that people have access to their medication management, whether it's long-acting injectables. We work closely with aid and assist dockets and courts here, and also with the county attorneys and the defense bar, because one of the things you find when people find themselves in custody and are suffering a psychiatric breakdown, there's a lot of supports that are needed to be in place. So a lot of work that goes on with that. And as I said before, I'm happy to answer a lot of questions on that. I can really get into the weeds with all of this, but I'm going to try and get through the rest of my presentation. And, obviously happy to send any emails and information to folks as they ask. Next slide, please. Some of the other services that we provide within Multnomah County Corrections Health, as you can see, we offer OB care. We actually have a contract set up with one of our local area hospitals, OHSU, which is the Oregon Health and Sciences University. And we have OB fellows, about 6 of them, that stay with us on a 6-month rotation. and that provide OB care for all of the pregnant female adults in custody that we have. And so it's a really, really great service. Multnomah County Sheriff's Office is an excellent partner in helping to navigate, visits between the sites. But the OB fellows actually come into the jail and are able to provide pretty comprehensive care and follow-up for those who will get released into the community to ensure that, for a lot of them for the first time, having that touch with providers for OB care. We offer X-ray services, we offer physical therapy, occupational therapy services. As I mentioned before, we run our dental clinics across each site. We have comprehensive lab services as well. And then, just a day-to-day care, which includes emergency management, So one of the things that we, have seen recently with the spike in fentanyl is we are engaging more in life-saving interventions because of overdoses within the jails and contraband getting into the jails. And we felt the need to try and meet this crisis in the best way possible. We have excellent nurses, excellent clinicians who've done so much in the way of saving lives. And recently we partnered with Portland Fire and our EMS system to purchase Lucas devices that will be in use when it comes to CPR and hopefully getting a little bit of a more success rate when it comes to life-saving interventions. And so we're working with them to ensure that our devices match what EMS has when they come on site, so everything is interchangeable. So a lot of work around that. One of the other things too that I wanted to mention on here, as you can see, is we have adult in custody workers throughout the jails. And one of the things that really is interesting to note is a lot of folks, when they come to jail, they want to not be stuck in a jail cell for 20 hours a day. They for their mental health and just general perspective, they want to be out and about, and they work as workers throughout the sites. And part of our role as the medical provider is to ensure that each of those individuals is able to actually accomplish the tasks that's set out in front of them. So we provide pretty comprehensive assessments, and then we share the information with the Sheriff's Office partners to let them know which workers are able to do what, and kind of operating from a screening perspective. Next slide, please. Again, when it comes to as we go through the slides, you will kind of see a theme here, which is and sometimes people are like, I didn't realize all of these things are done in a jail, so that's when Cassi said, what is jail even? We run very much, it's like running a clinic as you would see in any other setting. We offer vaccines and offered those through COVID-19. One of the things that we were exceptionally proud of when COVID-19 hit the jail facilities, and as you all know, throughout the country, the death toll was tremendous. We were pretty nimble in the approach that we adopted in contacting Oregon Health Authority partners, our health officer and our public health division director, and immediately worked on a pretty comprehensive approach to how we would manage COVID within the jails. And one of the big sources of pride is that throughout the entire pandemic, we didn't have a single death in custody from COVID, which I think was an anomaly in carceral settings and in congregate settings overall. In fact, we had, I believe, 3 hospitalizations that we had 2 incidental findings that were COVID related, but other than that, we, I think, did a pretty good job. And so when you're talking about vaccines, we would go into the housing unit section after section after section. I was out there. We had the Portland Fire Department helping us out with that. We had public health staff. We had a lot of volunteers coming in, doing a lot of education in the jails and a lot of vaccinations. And this is something that we continue with our own staff. Since the pandemic, weekly vaccination clinics are held. We offer flu vaccine, obviously, and we also, conduct TB tests. Multnomah County is one of the biggest hubs west of the Mississippi when it comes to the U.S. Marshal kind of transfer portal for adults in custody from one site to another. And part of that process includes ensuring that folks are TB tested and that we're not, kind of transferring disease from one site to another, and that includes obviously X-rays, TB plants and all of that to keep adults in custody safe. We run chronic disease clinics in our sites each week. HIV management, we're able to maintain folks that come into the community from, and we're able to verify that they're on a medication regimen. One of the really big benefits we have as a division and as a healthcare provider within our jails is we use the same EMR system as all of the area hospitals. So when you're thinking about kind of a comprehensive approach to dealing with people in a point in time, it's really critical to be able to meet people where they're at and to kind of have a little bit of an idea of who you're dealing with, which a lot of the people that we have, the nature is so transient where you don't sometimes have a baseline, but for having Epic, we are absolutely able to check and see they've been in the ED the last 6 months. They were there last night. Here's what they had going on. And so we utilize a system called Care Everywhere within Epic to really drill down and see what's going on with the adults in custody and able to really provide some great follow-up care while they're with us. We manage all of their outside appointments alongside the sheriff's office that run all of our transports for them, and we also have eligibility specialists that are able to get people signed up as they're about to transition out into the community. I think it's important to note that I'm not sure if everybody's aware, but we have a 1115 waiver recently that is coming into place that would allow for adults in custody to maintain their insurance for up to 90 days when they are incarcerated. And so we are in the process of kind of planning around that and what that impact will be for our jail here locally, but also for across the state, because I think it's just going to be something that many of us are dealing with and trying to figure out how to navigate new waters, if you will. Next slide, please. One of the really big things that we've noted over the last 2 years is the need for transition planning. When you work at a hospital, one of the fundamental components they have is discharge planning begins on admission. So someone gets into the hospital, they begin discharge planning right away. And that for us, we tried to adopt a similar approach when it comes to transition services, because over the years, people come into the jail, we stabilize them, we look after them, and then you send them out in the community, and then they recidivate, and the cycle goes on and on and on. And it's like, where do we break the cycle? And so we felt the obligation to really drill down. So over the last 2 years, we formed a new transition services program within Multnomah County Corrections Health that has a massive focus of providing warm handoffs for adults in custody and youth in custody as they're getting released into the community to help them succeed. So obviously that includes medication supported recovery, or MAT as most people know it. Again, that's just a term you'll hear me use, MSR versus MAT, because MAT as it is medication assisted treatment is not comprehensive, including the peer support, the behavioral health needs, and kind of the comprehensive approach that you're supposed to have. And so medication supported recovery is actually a more appropriate term that captures all of the work that goes into substance use disorder treatment. So that's something that our transition services program has a big focus on, including, cabbing people to the pharmacy, helping them get the medications. Oftentimes we actually have their 30-day medication within our hands, and then we work with local peer communities that will then come into the jail, into the lobby, and able to help people navigate all of the things that they need once they get released into the community. So it's been something of a big source of pride, but also a fastest growing program within Corrections Health, because the need is vast. We are getting about over 300 referrals each month right now, which is unheard of. There's a lot of folks who are ready for treatment. There's a lot of people that are very afraid of the fentanyl issue that we have in the community, and people don't want to die. And so we are really working closely with adults in custody and all of our community partners to keep people as safe as possible. Next slide, please. One of the things that the Transition Services Program really focuses on is the social determinants of health. Without this, it's just really impossible for appropriate discharge planning and helping people to get into the community, stay in the community, and be successful in their next phase of life. If you want to go into the next slide, it kind of goes a little bit more into the details of what that looks like when you were dealing with the social determinants of health. So we have our staff on hand almost 24 hours a day. With the transition services, we've worked alongside the sheriff's office, and thankfully we don't have a lot of releases that happen in the middle of the night, as used to be the case years ago, which then allows us, to help them with the IDs, bus passes, getting gift cards, getting food vouchers, working on their healthcare pieces, cabbing them from place to place. So when you look at these lists, they're super comprehensive as it relates to what we look into. And again, as Paul mentioned, this is information that we will be happy to share with you all. But we feel that we heavily felt the obligation to not just simply look at what we're doing for adults in custody when they're sitting in the jails or when they're with us, but rather what can we do to help them succeed? Recidivism is always kind of a pie in the sky, but when you think about it, it really is a long journey of small steps, and kind of dealing with the social determinants of health and ensuring that people have things like that, I think would really get us into the place where we can make an impact when it comes to recidivism and providing people the opportunity to be successful in the community. Next slide, please. So that for me is the end of my presentation. There's a lot more, as I said, I could go into, and I think one of the things that I've appreciated about partnership with CareOregon with Clackamas County is more than ever, there's that openness for information sharing and nobody hoarding anything, because we are all working towards the same goal, which is to save lives and to keep people safe. And so we are always happy to share any and all information as requested. And I'm super excited to hear what our next presenter will have on board, because she is brilliant and has been a pleasure to work with over the years. So thank you all so much. Thank you, Paul. And yeah, I'll be here for any questions later.
Myque, thank you so much. That was incredibly revealing. So we really appreciate you making time to do this today, and for joining us later on in the question and answer panel. So attendee friends in that chat section, feel free, as questions occur to you, to go ahead and put them in there, and or we can ask questions from you later on as well. Either way, but we'll have plenty of time to go ahead and address those in our Q&A segment later on this morning.